I'm James Zanewicz from Tulane Medicine, here at the Bullpen during JPM 2025 with Ludovica Labruna from Magnetic Tides. Thanks so much for joining us.
Thank you for having us.
It's great to have you in the Bullpen. I have 3 easy questions for you. The first one is just telling us a bit about your history and yourself. How'd you get where you are today?
I am a neuroscientist. I'm Italian, and I came to UC Berkeley almost 20 years ago to finish my PhD in neuroscience, and started to work with non-invasive brain stimulation there. That is a method that we can use to, in a very comfortable way, changing excitability in the brain. And I've just been a scientist for 20 years. There, and then working with non-invasive brain stimulation, I was frustrated a little bit by the results that I was seeing in science, and so I went to talk with the engineer and physicist at UC Berkeley, and we decided that we needed to invent something new because what was available in the market didn't have a clinical impact as we wanted. And so I founded Magnetic Tides in 2019, and now I'm an entrepreneur neuroscientist.
That's fantastic, and I think it's going to lead to my next question, which is, what do you think about when you get up every day? What are you working on?
So we developed an innovative non-invasive brain stimulation device that is a very comfortable device to that we are targeting now is chronic stroke patients. So we are revolutionizing the way that we use the device for chronic stroke. So every day, basically, we are doing more research and development on the device, and we are running a trial on chronic stroke patients for motor recovery. We have very promising pilot data in which we show that the recovery of our patients have the same results of an invasive method that has been approved by the FDA as a breakthrough device, but 80% of the patients, they have side effect. We don't have any side effect. There is
that's incredible.
Zero sensation during stimulation. So these patients that already, frustrated, they had the stroke, they're chronic, they don't have any hope, they come to our lab, they do this 20 minutes of stimulation, and then after 10 weeks, they get better.
Oh, wow. So the Bullpen is all about finding someone, helping and repeating, much like your company, you're out helping people. But the Bullpen wants to help its fellow members. All of our members are here to help others achieve their goals. How can the members of the Bullpen help you move your company forward?
So it's first of all, I love Bullpen. I mean, the mantra of Bullpen, it's something that I strongly believe, and I love the life science. It's all about this, right? We are all company that we have the main goal to try to make it better for people that have disease and suffer. So Bullpen is a small word of the big picture of the life science, I would believe. Help me to make the next step with this device, because we really believe that we can help a lot of people with neurological and psychiatric disorder. So right now we are looking for funding for the next stage milestones. We have a lot of non-dilutive funding from NIH, so we already had almost 5 million of non-dilutive funding.
Oh wow, that's impressive, yeah.
From NIH since we started the project in 2019. We anticipated other 3 million coming in 2015. So we are recognized by the institution that really work with science and mostly stroke patients. But we also believe that now is the time, now that we have our study and our results, we believe it's time to commercialize, to move faster, so that we can really, in a very fast way, reach the population that needs. It's an unmet need, the recovery of stroke.
Mm-hmm. So what kind of funding round are you looking to raise right now?
We really see the round. We have a lot of grants that we submitted in 2014, so the amount of money that we are looking for will depend by how many grants non-dilutive will
Because non-dilutive is better, yeah.
Non-dilutive is, also I have to say, NIH, it's the best place to be working with. I mean, the people that they're supporting the company with SBR, they are incredibly helpful and want us to make the difference. And so they're also having the support of NIH. For me, it's not only having the money, but having the support of NIH, all the staff from NIH. They are teaching me a lot. They're pushing the device forward. They believe in it. So it's fantastic being in the community.
Yeah, and they're also members of the Bullpen for the same reason, because they're there to help people and repeat. It's kind of crazy.
Exactly.
Well, it's been so great having you join us here in the Bullpen at JPM. I hope you have a great rest of your week and that 2025 brings you everything you need to move this incredible treatment forward.
Thank you so much. Thank you for having me. Thank you.